Welcome to Section 3 of the Renal Physiology Review. In Section 3, we will introduce the concept of the glomerular filtration rate and introduce how glomerular filtration occurs and how this process is regulated through the Starling forces. Welcome to Section 3 of the Renal Physiology Review, glomerular filtration rate. In this section, we will first define glomerular filtration rate. We'll then move on to regulation, how we measure, and finally we'll move on to the concept of clearance. In terms of the USMLE Step 1 exam, understanding glomerular filtration regulation as well as measurement are extremely important concepts. We will highlight them in detail and go through these concepts from multiple viewpoints. The definition of glomerular filtration rate is the volume of plasma filtered across the glomerulus. It's usually measured in mLs per minute. The approximate normal value is between 90 and 125 milliliters per minute. Very roughly, one can remember that a normal glomerular filtration rate, or GFR, is 100 mLs per minute. The GFR depends on Starling forces, the filtration pressures, glomerular permeability, and the surface area of the capillary bed. We can look at this mathematically in that the GFR is equal to the filtration pressure times glomerular permeability times the surface area of the capillary bed. In terms of the filtration pressures, or the Starling forces, recall that the Starling forces govern the movement of fluid and solute across all capillary beds. The net filtration pressure, meaning the net pressure that drives fluid and solute across the capillary bed, is equal to the difference of the pressures that promote filtration minus the sum of the pressures that retard filtration. The sum of the pressures that promote filtration are the hydrostatic pressure in the glomerular capillary, as well as the oncotic pressure in Bowman space. The pressures that oppose filtration are the hydrostatic pressure in Bowman space and the oncotic pressure in the glomerular capillary. Let us review the concept of filtration fraction. The filtration fraction concept will come up on your USMLE Step 1 exam. The kidneys filter a lot of blood. As we said, the renal blood flow is 20% of the cardiac output with each cardiac cycle. The rate of renal filtration exceeds that seen in muscle capillaries by over 1,000-fold. This is due to not only the large blood supply to the renal circulation, but also due to the high permeability of the glomerular capillary bed, as well as their much higher hydrostatic pressure. It is no wonder, then, that the kidneys need to reabsorb most of what they filter. What is meant by the term filtration fraction? Filtration fraction is equal to the GFR divided by renal plasma flow. Essentially, it's the fraction of blood that is presented to the kidneys that is actually filtered at the glomeruli. Normally, this value is between 10 and 20%. Let's go into more detail into the Starling forces that govern glomerular filtration. There are 4 forces total, 2 in each portion of the glomerulus. There is the hydrostatic pressure in the glomerular capillary, as well as the oncotic pressure in the glomerular capillary. There is the hydrostatic pressure in Bowman space, and there is a corresponding oncotic pressure in Bowman space. The important concept to remember is that hydrostatic pressure pushes fluid and solute through a capillary bed. Oncotic pressure pulls in fluid and solute through a capillary bed. Therefore, the pressures promoting filtration are the hydrostatic pressure in the glomerular capillary, which is going to push fluid and solute out of the glomerular capillary, plus the oncotic pressure in Bowman space, which is going to pull fluid and solute into Bowman space. The two forces opposing filtration are the sum of the oncotic pressure in the glomerular capillary, which is going to pull fluid into the glomerular capillary or prevent fluid from leaving the glomerular capillary, and the hydrostatic pressure in Bowman space, which again is going to prevent fluid from pushing through into Bowman space. Let us take a brief aside and review the difference between oncotic and osmotic pressure. They're based on the same basic concept. In each case, there are substances which are incapable of crossing semi-permeable membranes. A concentration gradient of these substances across a semi-permeable membrane will exert a pressure upon water, which is capable of crossing the membranes. In both cases, the pressure will tend to drive water into the compartment with the higher concentration. Osmotic pressure is exerted by electrolytes in small molecules, often charged, or electrolytes or polar compounds, which are incapable of crossing cell membranes. The major component of osmotic pressure throughout the body in the extracellular space is sodium. Oncotic pressure is exerted by large substances, such as proteins that are incapable of crossing capillary walls. The major determinant of oncotic pressure is albumin. Once again, glomerular filtration rate is dependent on the net filtration pressure. There are two forces promoting filtration and two forces opposing filtration. The two forces promoting filtration are the hydrostatic pressure in the glomerular capillary plus the oncotic pressure in Bowman space. The two forces opposing filtration are the hydrostatic pressure in Bowman space and the oncotic pressure in the glomerular capillary. The difference between these two forms the net filtration pressure. Once again, the above equation is easy to remember if you recall that hydrostatic pressures push or promote fluid out of the compartment, and oncotic pressures suck or promote movement of fluid into a compartment. Let's do this with a few numbers. The forces affecting filtration, again, are the hydrostatic and oncotic pressures in the capillary bed of the glomerulus as well as Bowman space. You can see here the net filtration pressure is determined by these components. The numbers are not important to remember. However, for the purposes of the review, the glomerular hydrostatic pressure, which promotes filtration, is approximately 60 millimeters of mercury. The Bowman's capsule hydrostatic pressure, which opposes filtration, is approximately 15 millimeters of mercury. Glomerular oncotic pressure, which opposes filtration, is approximately 28 millimeters of mercury. In the normal physiologic state, the oncotic pressure in Bowman space is essentially zero. As we said, protein should not be filtered into Bowman space due to the selective charge and size barrier that we outlined previously. Therefore, the net filtration pressure is approximately 17 millimeters of mercury. The number itself is not important to remember. Simply recall that the concepts of the two forces promoting filtration and the two forces opposing filtration. Let's walk through some disease states and how they might cause changes in glomerular filtration. As we said, the kidneys are highly sensitive to the blood flow. If renal blood flow is decreased in the setting of systemic hypotension, then glomerular capillary hydrostatic pressure goes down. The end result is that net filtration goes down and glomerular filtration rate goes down. If there is increased hydrostatic pressure in Bowman space, which is usually a low number, such as in the setting of obstructive nephropathy, one can see that this will oppose filtration, which then will decrease the GFR and renal function. In minimal change disease, we said that protein leaks through the capillary bed into Bowman's space. In that case, the oncotic pressure in Bowman's space will go up. This will promote filtration and increase GFR. Finally, if plasma oncotic pressure is affected because of decreased serum albumin concentration or hypoalbuminemia, this is a force that usually opposes filtration. As this goes down, however, filtration fraction and GFR will increase. This concludes Section 3 of the Renal Physiology Review. The key points to remember from Section 3 are that glomerular filtration is primarily dependent on the Starling forces. There are two forces promoting filtration, the glomerular capillary hydrostatic pressure and the oncotic pressure in Bowman's space, as well as two forces opposing filtration, the oncotic pressure on the glomerular capillary and the hydrostatic pressure in Bowman's space. The relationship between these pressures determines the ultimate glomerular filtration.